it's not just a simple labor question. Obviously, we have a commitment to ensure or do our best that we keep improving the health systems in our country. And so that's SDG 3, good health and well-being. And then there is SDG 8 on decent work and economic growth. We want our health workers and all those involved in the health sector to have decent work and that it contributes to economic growth. To be clear, our provision in the existing law on the UHC Act states that RA 11223 or the Universal Healthcare Act mandates that the Department of Health, together with other stakeholders, shall ensure the formulation and implementation of a national health human resource master plan that will provide policy and strategies for the appropriate generation, recruitment, retraining, regulation, retention, and reassessment of health workforce based on population health needs, and to ensure continuity in the provision of the health program and services. All health professionals and healthcare workers shall be guaranteed permanent employment and competitive salaries. Let me stop there, no, on that last phrase, competitive salaries. It is a reality that our human health resources, from our doctors to our nurses, our physical therapists, our pharmacists, and many others, our scientists, are very much in demand all over the world. No, they are amazing at their job. They are well trained. And they have very bright futures in other countries. And what we want to ensure here in the discussion is that we are mindful of the right to explore greener pastures. But we would really like the Philippines to be a pasture that they are also content and happy with. I think that is what our goal should really be. Libre naman lahat, kahit naman ako nung after college, nag-explore din naman akong mag-aral at magtrabaho sa ibang bansa. It's just a thing that I think young people want to do. But in my case, as a lawyer, as a future lawyer, nag-decide ako na my future is in the Philippines. Pero for health workers, maganda talaga yung future din nila, yung offer sa kanila sa ibang bansa. But this is what I'd like to start with. I know there will be lots of solutions. This is not just going to be the only hearing. There will be more hearings and technical working groups and consultations. There will be many solutions offered. And the Senate has done its part. Congress has done its part. You know, we've heard different, of course, the UHC Act itself is instrumental because it allowed, it provides a more I think a better career path in the sense that there is more funding for healthcare. So kahit ang mga doktor and other health professionals have earned a better living because of the laws that we've passed from the sin tax law, which requires that the proceeds go to the implementation of the UHC and health facilities. May doktor ka nga, wala naman siyang pagtatrabahuhan, wala namang health facilities, no? And also medical assistance. So we have laws that we've passed that will improve healthcare. But, and let me mention another law, Dr. Para sa Bayan, my co-sponsor in this resolution, Senator Joel and I, both worked and continue to work on the implementation, on the passage of that law and now on the implementation. But this is what I'd like to point out, no, when I say that maraming possible solutions. So one solution, yung Doktor Para sa Bayan, precisely was to really encourage more students to take up the profession of to become a medical doctor by having more schools available to them in different provinces and by supporting these schools, no, because gusto nga magdoktor, ang layo naman sa kanila and congested na sa Metro Manila, wala nang chance na dagdagan pa yung capacity nila to absorb more students, so wala rin. So this law addresses that. But what I'd like to point out is something that some consider sensitive and difficult to discuss, but we have to have these difficult conversations. Asan ba ang need? Do we need more doctors? Do we need more nurses? Do we need more of those to enter the allied profession? I humbly submit that we need all. We need all. Nagkataon lang na yung batas na napasa is Doktor Para sa Bayan. But in the budget, and I handle the budget of both education and health, we've included provisions that will support enrollments in these other allied professions. But that's what we need to discuss kasi nasan ba ang mga gaps and ano bang profession ang kailangan natin i-tweak? Can we have the political will to change curriculums so that we can adapt to the need? So, hindi naman gagaling sa akin. I will wait for it to come from the experts themselves kasi marami talaga akong narinig na solutions, including expanding the role of nurses, na maging nurse practitioner, and so on and so forth. So let's explore that because at the end of the day, we need to choose the best solutions and we need to act now. So I will leave it at that. Let me just put on record that my colleague, Senator Joel Villanueva, has his opening statement, which he said to insert in the record. But allow me to just highlight a few things. In July 2018, Senator Joel co-sponsored the Universal Healthcare for All Filipinos Act, and then this became RA 11223, and he emphasizes that currently there is only one physician attending to the needs of an entire municipality with, say, 20 to 30 barangays. So this is the sad reality that we are faced with. And as I mentioned, we passed the Doktor Para sa Bayan during the pandemic with a desire to address that gap that we have. As of December 2021, the current ratio for doctors has improved to 3.7 per 10,000 population, compared to 2.6 at the time we were deliberating this. So let me just quote, thus we cannot stress enough how important this hearing is, largely because of the unprecedented nature of health emergencies and pandemics. We must devote all the time and efforts and even the scarce resource that we can muster because this issue is a matter of life and death. So I am inserting this entire speech of Senator Joel Villanueva into the record. So on that note, we can proceed with our hearing. And one last administrative detail. Many of you are familiar faces, so but for those who are new, I have some rules. I'd like this to be interactive, so speak candidly. Huwag niyo na ho akong basahan ng speech kasi pwede naman ako magbasa pag hindi na tayo magkasama. I would prefer that you highlight the key points in your speech so that I can focus on it another time. But while we are here, I want you to really just emphasize the key points that you would like us to be aware of. This hearing is online, so the other senators will be able to watch it any other time. Also, although maiksi lang itong hearing because unfortunately I have a very busy schedule today, so when I have to cut it at 3 o'clock sharp, rest assured that there will be more time for more interaction. And I think that was it. In as much as I want it to be as interactive as possible, and I will try to accommodate quick remarks to any statement, I may not be as interactive as I'd like it to be, just given that today is really tight. But I wanted to be sure that we could start this very important discussion so that while we are not in session for the entire month of April, we can work on it and hopefully when we resume, baka may ma-sponsor na tayo. Okay? All right. So let us start. And by the way, you are free to stand up anytime for a mobility break, and hindi nga mahaba, but if you need to go to the CR, I'm not strict about it. I will tell you who's next so that nakaka-ready kayo. Otherwise, feel free. And also, we don't have PET bottles here, so we have we're supposed to have a water dispenser, but can I just ask the page to ask who wants water so we can give them water, pero no PET bottles, please. Okay, so we are ready to start. As I said, I will mention those present as we go along. Are they all speaking?
Yes.
So do you want me to mention them pa now? Just because they're not here, or later na lang?
Later na lang, then let's start with him.
We're starting with him? Hindi DOH.
Yung sa principal ako na. So, he's abroad.
Okay. Sige. All right. So I normally start with DOH because obviously they're the agency that is most involved in this. But we do have an international expert with us. So with your indulgence, everyone, I appreciate the technology that allows us to speak to to allow us to invite international experts. So let's call him. This is Professor Sohail Inayatullah, who has so kindly graced my hearings in the past. And Professor Sohail is UNESCO Chair in Future Studies at the Segetera Center for Sustainability and Humanity. So, Sohail, you have the floor. Please go ahead.
Thanks so much, Senator Pia. Always great to be here. Just go for 5 minutes. Is that enough? How long would you like me to talk
Yes.
for?
Yeah,
Okay.
that's good because we're on a tight, but if you will
Yep,
indulge us in the future for a discussion, we would love to have you again.
5 minutes is perfect. I'll just screen share. Will it let me? It probably won't.
Screen share. Screen share? No,
Yeah.
of course we can do that.
If you can just put yeah, it won't let me. Just if you can, the PowerPoint ahead. If you want to share that. If not, I don't need the PowerPoint. I can just talk about the story. We can skip the PowerPoint. Let me just talk for a few minutes. Oh, we're already good. Okay, so if we can go,
They're doing it.
the next slide, please. So basically, I know you have details to figure out, but just to frame this is based on 20 years working with Big Pharma, Bangladesh, WHO, hundreds of health groups in Asia. The first thing I've learned is there's an endless demand for health products. Whether pharma or wellness or well-being, the demand is endless and it keeps on going up. Second is the result of that is there's health inequity. Where you're born determines how long you'll live. The problem we have today throughout the region is the car road worldview, i.e. pollution, which is reducing our lived years. The solution is not just more wellness products or more drugs, but rethinking the design of the city. It's doctors, nurses, plus designers, what's called the walkable city, where everything is near. This means in Asia, transforming our desire for the car to the community. I was working with Mitsubishi Motors. They said, right now we sell cars. We should be focused on selling mobility, green, safe pods using technology. So this means working with patients, empowering them so they define their health journey. So yes, it's nurses, doctors, therapists, but how do we help the patient redefine their life journey? So one conclusion that came out in many places is the multi-door health center. So there's a doctor and then there's different providers. The doctor gives the evidence base. Who should you see? Is it mental therapy you need? Is it genomics? Is it 3D printing? Is it exercise? Is it a GP? So this is a new framework, and ultimately that's moving towards the home and the hospital. I know that seems way out, but we have to start thinking people don't want to be in hospitals. We have to find funding for the home and the hospital. Essentially, that means moving from illness to prevention. My favorite metaphor is a mango a day keeps the doctor away. So let me go further. I'll skip go ahead. Next slide, please. Next slide, please. Okay, so it's not doing it. That's okay. Next, I'll just end with the conclusion here. Next. So in Brunei, we were talking about its live tweet. Next one. In Mongolia, we changed the story again. It's not the can or the carrot, but your stomach is not a garbage can. Much of health is changing the story. When working with disability futures, the one thing we found about human resources, there's a divide between carers and tech. So what the people with disability want, we want carers who understand technology, who can connect us with medical appointment, with banking, with shopping, with online communities, our loneliness. So the big HR thing is moving from illness to prevention, but carers who understand tech and touch. Next one. So this is the big transition we're seeing throughout the region. Now, to make this happen, it's empowering the patient. What does the patient want by 2030? I own my data. Who owns my health data? I expect privacy. I am involved in my own health journey. I work seamlessly with AI. I have access to my digital twin. Every patient needs a digital twin. And finally, there's a movement between nature, self, medical environment, and your personal life journey. This has to be seamless. Next one. At the same time, we're seeing transitions on the employee. It's not just traditional medical systems which are hierarchical. It's really working anytime, anywhere from anyone. So we're using health diagnostics for prevention and connecting with humans to make us feel better and help us on our health journey. So this is where sharing information, we're collaborating, adaptive learning, democratization of health. Next slide, please. So this is moving the workforce, diversity and inclusion, meaningful work, and the employee experience, engagement, and performance. This is a major shift in how we see HR. Next, far more adaptive, far more flexible. Next slide, please. Again, the whole notion of the multi-door health center. So this is helping the Philippines move towards adaptive, high-tech, high-touch, caring for the ager, green products, and rethinking city design. It won't happen without pollution transforming, better food, taxation on junk food, because we know the demand for pharma and wellness is infinite. Final slide. So what I've done to try to is paint you a view of the future. Care plus tech, home hospital, aging in place, flexible work, and partnering with everyone. Thank you.
Thank you, Sohail. 5 minutes is not enough.
No,
This
it
is
gives
really
you a
just like an intro, but I hope you'll indulge us for future hearings where we can probably go into details because for our colleagues here, Sohail's focus is on the future, and most of us, our work, in as much as we'd like to be futures thinking, we're stuck in the now, no? Because we have to always be putting out fires all the time. So I always appreciate it when we have a futures thinker with us because they really help us, try to find time to really focus on where we want to be. So thank you so much for your time, Suhail, and we'll be in touch. See you
thank you,
again.
Senator. Please do.
Okay, so let's go now to DOH. USEC Kenneth Ronquillo will be the one to present. And then after DOH will be CHED and then PRC.
Thank you very much, Senator, and good afternoon. I'll be giving a quick presentation on the updates and implementation of the National Human Resource for Health Master Plan. Can we have the next slide? Yeah, okay, thank you. So for the master plan, we actually use a labor market approach to show HRH mobility from production of health workers and professionals to being part of the workforce and exit and re-entry of the health workforce. This framework highlights not only the key HRH provisions in the UHC Act, but also the overall goals of the health workforce. These are the sustainable production of human resources, practice-ready training, job generation, and competitive salaries, accessibility and retention mechanisms, as well as productivity and career development, all of which lead to providing the right number, competence, and skill mix of human resources, performing at the right work, at the right place, and the right time with the right compensation. Next slide, please. The next few slides, we took this from CHED. So, madalian na lang po siguro kasi may CHED din naman po dito. But we actually look at graduates of the professions that is being regulated by PRC. This is a 10-year period of doctors, midwives, medical technology, and pharmacy. And we provided here the 10-year average enrollees and 5-year average enrollees of these professions. Take note that during the pandemic, medyo nag-decrease yung number of enrollees natin and graduates as well. The next slide, very specific for nurses over the past 10 years. Ito po, but also because there has been a moratorium on the number of nursing schools over time.
Maria, can I just make a comment?
Yes, ma'am.
This is on enrollees, right?
Graduates na po. Enrollees
Okay.
to
So hindi
graduates na po.
enrollees, graduates to.
Yes po.
Okay, but board passer, dapat may slide
Yes,
ka
ma'am.
to show that
Yes.
to show the difference because to be clear, I appreciate that you pointed out that there's a factor which is the moratorium, but I also want to see dahil nagka-moratorium, kumonti ba ang pumapasa? So, yun lang kasi pumupunta na tayo sa argument na kaya pala konti lang kulang listeners dahil may moratorium. Eh baka naman mas konti lang din ng aral tapos hindi naman papasa. Tapos ang career nila wala namang kinalaman na sa nursing dahil di naman sila pumasa. 'Di ba? So I wanna be sure that you discuss that. Yun
Yeah.
lang.
Sige po. The next slide, please. So this one's naman for dental medicine, nutritionist, dietitian, PTOT, and RadTech. So we see increases over a period of time, but during the pandemic, bumaba na po yung mga number of graduates natin. Well, the next slide provides us a summary.
Before you go to the next slide,
Yes, ma'am.
I just wanna take a few seconds to just look at it. So I cannot see kasi the ayun pala ang legend. So itong bumaba is the radiological and x-ray technologies. Yan yung babang-baba, yung from 3.2 now naging
For this
1,000. But
slide,
there
ma'am.
might be some other factor there kasi yung iba naman, yung PT, same, medyo paakit pa nga ng konti. The black one, which is dental medicine, bumaba siya but not as drastic.
Yeah.
So anong ibang factor, do you know?
Well-
Anong ibang factor na ba't ganito ka-drastic yung baba ni PT and OT?
The decrease of the PT and OT, yung kwan din kasi ma'am, positions that are available during the workforce side. So we have enrollees, pero hindi sila nakakahanap ng work dito. That's also a big factor kung bakit yung enrollees kumukonti doon sa PT OT.
Really? Kasi I know there's a shortage, so there must really
Yes.
be. Asa na ba si dito? Sino ba yung representative natin sa
Madam Chair,
labor side?
Madam Chair, if I may.
Joel, is that you?
Yes. Yes,
I
sorry.
know your
couldn't-
voice. I cannot see your face. Pero kilala ko
Sorry.
yung boses mo kahit saan. So,
I know, I'm so
go ahead,
sorry.
Go ahead.
I'm so
Majo,
sorry.
go ahead.
I couldn't show myself because I'm mobile.
It's okay.
I'm having a hard
It's
time.
okay. No
I
worries.
was just
Don't worry about
wondering
it.
about that data that you mentioned because I really feel that there's a big shortage. I, for one, has been having a hard time looking for OT and the
I
PT.
know.
And so I'm a little bit concerned about it. And at the same time, Madam Chair, if I may, with the indulgence of our resource person when he was presenting some of the data on human resources for health ratio, I was wondering if we have that ratio per 10,000 population because I remember during the time, during the budget hearing, when we asked the DOH, the latest data was 17.48 per 10,000. But the requirement, as we were told, 44.5 per 10,000, which means at least you have about 14.3 physicians, 27 nurses, 2.8 midwives are required to reach that 44.5. But right now we are still, the last data that was given to us is for 17.48 per 10,000. So I would like to know when do we target to achieve the ideal ratio and what steps have we taken so far. Thank you, Madam Chair.
Thank you. Majority Floor Leader. Actually, that's a good question. I think you and I have had this discussion on the floor, no, on various occasions. And Dr. Tony Dance later on, who's here online, I remember he shared with us in one hearing something about how many years it would take, assuming, yung when we discussed the Doktor para sa Bayan, meron siyang presentation niya na how many years would it take para we will have sufficient number of doctors, and meron yon. I forget the number, but maybe later he can answer this. And then, yung nurses, never in our lifetime natin ma-achieve yon. So, may ganung mga numbers. But if I may also second the observation of our majority floor leader na I personally am aware that malaki ang shortage ng PT and OT. Napakahirap maghanap. The OTs have been very how do I put it? Like yung understanding ko sa OT 20 years ago, I don't know if they're, what do you call this? I don't know if we've expanded the work that they do, or the demand is just really there now because people understand more the importance of the interventions of OTs. So mas marami lang ang naghahanap, pero grabe ang demand. So I was telling my staff na, and I tossed this back na lang to DOH because obviously you'll be central in all this planning, na parang medyo mahirap yon na if you tell us na wala silang trabaho, and yet even in terms of personal, maraming PT na freelance, di ba? They are connected with directly with doctors who will then recommend them to their patients. So whether employed sila or freelance sila, maraming ganun. At marami din ganun na OT. And from what I know, sobrang kulang. So there's a misunderstanding here in the reporting, or at least yung nakakarating sa enrollees, na feeling nila wala silang trabaho. Okay, so that's already one of my takeaways here. Now there seems to be a
Yes, ma'am.
lack of understanding or lack of information na nakakarating sa enrollees, or even their parents, kasi at that age very instrumental ang parents to help guide the child kung anong course ang kukunin nila, for them to think na walang demand for PTs and OTs. Okay, so on that alone, I would like sa next sa technical to get the side of the practitioners in this field, and like the sports medicine doctors, which is an area that I'm very much present. Marami akong sports medicine doctors, to find out kung sa tingin nila may kulang yan. Okay? Anyway, that's my first takeaway. Go ahead, Yusek.
Okay, ma'am. So if may I just respond muna sa PTOT, what we were trying to say is that while there's a need for PTOT, we do not have as much civil service positions for them. So
Yeah, but
konti po
we are
yung
not the only employer. The
Yes.
civil service is not the only employer. So thank you for that clarification. I would have assumed nga na ganun. But is that enough reason for that to go down? I mean, you would think that and maybe to follow na lang, kasi baka hindi na natin marinig yung iba. Dami ko ng tanong sa inyo pa lang. The state universities, at least for the state universities, no, but for both, no, even the private HEIs, dapat alam nila. Dapat alam nila. So pag nag-counseling yung bata na saan ako, ano kayang course ko, maayos nilang masasabi yun na ito ang future mo. Okay? So yun, ang kailangan nating anuhin. So when we talk to Ched later on, no, I'll invite Pasok. Let's find out let's randomly ask courses that offer PT, occupational therapy, radiotech, o tanong ilan yon, tapos tanong natin sa kanila, bakit bumaba dyan? Wala bang trabaho? Pati sa mga private, wala? Okay, go ahead, sir.
Okay, then. So if we may continue this is a summary of all the enrollees, graduates, and board passers of the previous slides that I've talked about. If we see that's only about 22% of the enrollees have graduated, and those who pass the board exams are only about 16% of the average enrollees, or that's about 73% of the average graduates. So marami pong enrollees mababa.
Let me say something about this. This is total na of what? Enrollees of what?
Of
Various courses.
Yes,
Okay.
po.
So let's use 2000, maybe mga bandang 2019. So the figure of enrollees is 226,000, correct? For the record, no, importante ito kasi para matulungan din tayo ng media friends natin to share the correct data. So tama, I'm looking at your slide, no, 226,315 ang enrollees, right? Around 2019, correct? Okay. And then in yellow is the graduates, 43,195. But does that presuppose 226 yung enrollees? So do I assume divided by 4 ang first year, second year, third year, fourth year, so you only expect na 1/4 ang gagraduate? Baka I don't want to jump to a conclusion na 226 tas 43 lang yung nag-graduate, or are you talking about 226 who total yan of all the enrollees, first year, second year, third year, fourth year, fifth year?
Well, of all
So how would you know? So this slide doesn't tell us the dropout rate. No, o kaya nga. So it's possible if I divide that into 4 or 5, and when you say human resource, you're also including doktor. So ang hirap ko i-assume in 1 year. Tama ba? Do you guys understand me? Tama ba assumption ko? It's hard for me to make any conclusion with the 43,000 numbers of graduate with 226 enrollees, because it's possible that that you have a 95% graduation, pero only the graduating only the graduating students will be represented here, right? So I can't form any conclusion. It's not correct to say, I don't know the purpose of that slide
Okay,
then.
ma'am. Yeah. So, yeah, really, these are enrollees or entrants to the courses, those who completed graduates and board passers. So, but I understand your point.
Enrollees
Hindi
are
na siya
freshman
nai-
enrollees or not necessarily yung kompleto
Yung
na?
mga dropouts, ma'am, ang hindi na consider dito.
Kaya nga. So I won't draw any conclusion kasi that
Okay.
would be unfair. And believe me, if somebody else was here, they will make that wrong conclusion. So let's be careful kasi doon ako papunta eh. So but what is this footnote that you have? Only about 22% of enrollees have graduated, or is that wrong? Do I assume that's wrong now?
If we use yung factor, kasi hindi na factor out dito yung mga dropouts, then this will change then, ma'am. Because we started only with enrollees, meaning entrance to these specific courses. So what we're trying to say is that if we factor in yung mga dropouts per year, this may change.
But you also have a conclusion here that those who passed the board is 16%. So
Well, of the graduates naman yan, ma'am. So of the total graduates, so those who completed the courses, 73% passed the licensure.
okay, sige. Can you come back to the next hearing and tell us na dapat sundan mo yun eh, of the freshmen who enrolled in
yeah.
PT, ilan sila across the board? Kung sinabi mo sa akin 1,000, by the time na fourth year at nag-graduate, ilan na si 1,000? 900? 800? Diba? Yun yung kailangan natin. And then, yung nag-graduate, ilan ang pumasa? So, can you break it down per specialty? Per
cadre po.
specialties. Kasi ang hirap naman ma-generalize, okay? And then also the percentage of passing, also based on the different specialization. Kasi it's also interesting to know na but ganon, baka yung iba higher than others, why? Lower than others, why? And what is the trend in other countries? Bakit naiiba sa atin, di ba? Okay, sige. Let's move on.
Well, the next slide will show us the HRH requirements based on SDG indicators. This is a collection from various sources of data. We use the data in the DOH collected by our regulatory bureaus, about 90% of public health facilities and about 50% of the private facilities are submitted, and this is the data that we have. So we looked at physicians, nurses, and midwives based on the demand that we have to put up a ratio of 44.5 per 10,000 population. So the ratio based on WHO references says that we need 14 at least per 10,000 physicians, 27 for nurses, and around 3 midwives per 10,000. So that is the recommended ratio by WHO. But the supply as we have now for doctors, nurses, and physicians, looking at the number of physicians, so meron ho tayong variance of around 70,000. But for nurses and midwives in absolute numbers, we have more nurses and physicians. But we're only talking here about the licensed health professionals, because in the next slide, please, will show you naman yung the truly practicing HRH in the country. So getting in the same number of the demand, the supply now is down to 283, 154. So out of the licensed physicians, these are the practicing doctors, nurses, and midwives in the country, which gives us a variance naman sa ratios natin. So While we have
So the other slide reflected what versus this?
yung nakapasa lang po sa license.
But not necessarily
Practicing.
nagpa-practice. Okay.
Yes,
So
ma'am.
that is the sensitive matter that I wanted to discuss, no? Because in the Doktor para sa Bayan and in the budget that I mentioned that we have for allied professions, we need to ensure that these are people who want to practice and stay in our country. Bakit naman tayo magsusustento? And I will never change my position on this. Yes, I feel that the country has an obligation to educate its people, but to educate them to the point na magiging doktor ka and then sa ibang bansa ka pala magpa-practice, I genuinely feel that that is not fair to the Filipino taxpayers. Kasi education naman should be available to all. Pero yung maging doktor or even maging nurse, napaka we spend and I intend to put in even more resources to ensure that they have really an even better education, more better facilities, better equipment. So kung aalis pala sila, then we really need to discuss this kasi some people are afraid to discuss it kasi baka daw sumama yung loob, magtampo, magalit. Bakit ka gagastusan kung hindi ka naman dito magtatrabaho, 'di ba? Pero like I said, we will assist. Of course we will assist because everybody deserves an education, but we have to determine that those who will we have to determine who will really stay here and serve the country, at least for a certain number of years, because I've already heard so much bad feedback, both, not just normally kasi public hospital, well, in fairness, ang daming public hospital na ang gagaling. Sa private hospital pa nga, no? Because we've been able to increase our salaries, 'di ba, for nurses. So medyo mas maganda pa nga yung kinikita nila sa public. So yung private ngayon nagsasuffer. And just like education, I always say the private sector is our partner in the delivery of education, delivery of healthcare. So what are we gonna do? These are problems that I need you to present me with solutions with, okay? Anyway, go ahead. It's very dismal, but it is what it is.
So the next slide, this is an old slide, but it provides us the health professional migration of
Sige,
both.
again, I have a question. Sorry,
Yes,
pero
ma'am.
magaganda yung data mo eh. When you say 156,000 temporary migrants, and maybe Yusek Olalia can help us here, they're only temporary because as far as we know, they are not permanent residents. But the chances na bumalik yan dito are probably small. Oh, correct. Let the record show that Yusek Olalia is nodding his head, so is Director Banson, and maybe so many other people here. So, liwanagin lang natin, di ba? They may not have permanent resident or citizenship in other countries, but what are the chances na babalik sila? Our experts now are telling us parang mababa yon, no? Because you're nodding your heads. Okay, I just wanted to put that
The
on
experience
record.
here, ma'am, is that they return here to get new contracts again.
Yun na nga.
And then return.
Yun na nga. So I
Opo.
think I mean it's valid data, but you might need to disaggregate it some more to be more specific, 'di ba? Kasi I really don't care what their status is there. I mean, in that sense, my job now, of course, and that's your job, Yusek, to look after their welfare. They are still Filipino citizens, but my job now is to find out how many are willing to work in this country, 'di ba? So whether permanent sila doon or temporary, wala silang balak magtrabaho pala dito eh. 'Di ba? So that's what we need to or what can we do to when they come back here, mainggit sila sa mga kasama nila, ang ganda-ganda pala ng buhay mo dito. What can we do to make that happen? 'Di ba?
If I may continue, ma'am. Yeah. So the next slide is a summary of the HR gaps. We use this study for the Human Resources for Health Master Plan. Very small, ma'am, but this is the adjusted demand and supply of selected human resources from 2020 to 2040. In each of these year, we looked at the requirements for both government and the private health sector and the gaps that we'll be having per year to see to it that we comply with the requirements of WHO, and that will be about 44.5 44.5 per 10,000 health workers. So we just undermined here year 2023 to 2028. At the end of this administration, we'll be needing about 26,000 more doctors in government and more in the private sector. That's 114,000. For nurses, that's about 110,000, but more in the private sector, that's 247,000. And midwives, that's 39,000 in government and 26 lesser in the private sector, that's 26,000. And then we have the rest also of the cadres. The next slide will provide us the cost, the summary of the costs. Costs, there are two that we costed here. Cost of training or producing a health worker, and the second one, the salaries and benefits of the health worker, both in government and in the private sector. So what you see here are actually the total cost of training and salaries and benefits per administration. So if we look at 2023 to 2028 for the cadres that we mentioned earlier, that will be about 670 million to cost for training and for salaries. We can disaggregate
You
this
mean
po
train
for
post
hindi po yung preserve
yung
producing.
education?
Yes, ma'am.
Yung education nila.
Education,
Okay, I
yes po.
understand. Okay, sige, let's pause there. I'll refrain from commenting except to say nga na kahit ano pang sabihin mong number dyan, so this is in the billions, right? Tama
Yes,
ba?
yeah.
Eh kung aalis din lahat yan, bakit tayo gagastos?
Yeah.
So that's what we have to go back to in the next hearing. We'll bring in NEDA, we'll bring in whoever private sector pa to figure out what can we do to make them stay? Because I am not going to support that kind of budget if aalis lang naman sila. And having said that, aalis at aalis talaga yon. So, okay, mag-report na sabi ni Pia Cayetano, huwag silang umalis. Kasi karapatan naman nila pumunta kung saan bansa nila gustong pumunta. But if a-fast track ko na, what I want to happen, maybe by the second hearing or the third hearing, is we accept and we determine that the only solution, not the only, sorry, I'm very open to other solutions. One of the solutions is these bilateral agreements with other countries wherein we recognize the reality that they will keep on knocking on our doors, breaking down our doors, kukunin talaga nila yung health workers natin. Huwag na natin i-deny yun. And we want our people to have those options. That is their right. No? Karapatan nila mag-decide sa nila gusto tumira at magtrabaho, etc. Pero gusto ko may mga agreements tayo in place such that pag kinuha niyo yung mga health workers natin, ito kapalit. Magpapaaral kami, magpapagawa kami ng building. 'Di ba? So, until we do that, and I've had this hearing in 2004, sadly, 2005, wala naman nangyari. My job is just to have this hearing and to push for these changes, pero it's the executive that will make it happen. We'll just be noting these figures and we'll just be funding these young people who will decide that they will go abroad, and we're not even trying to reach out. And so that's why we need not just DMW, but we also need Foreign Affairs. And maybe you can recommend, Yusek Olalia, kung sino pang mga ibang pwede natin isama dito sa hearing na ito. Okay? Doon papunta yung solution na naisip ko. But as I said, resource persons and people online, I'm very open to others. Marami pa. That's just one. Anyway, go ahead.
So we have had the approval of the National Human Resources for Health Master Plan at the SDC of NEDA, and what we are awaiting now is the approval of a draft executive order at the NEDA board, which is headed by the President. But this has not yet been forwarded to the office of the President, Senator.
So kasama ba dyan yung sinabi ko?
Opo.
Yung bilateral agreement?
Yeah, the bilateral agreements.
Okay, kasi nga, for everyone's information, that's not my brainchild. That's not new. Matagal lang umiikot yan. So nakakaiyak lang na hanggang ngayon, di pa rin natin ginagawa. So sana magawa na natin. Okay.
So, well, the next slide just shows us the current work that we're doing in terms of deployment of human resources for health. So as of January 31, we have already deployed about 16,410 of the different cadres that we have. But within the approved budget, that's about 24,000 human resources for health. So our regions are currently still putting up the numbers, madam. So we also have the scholarships, scholars for doctors, nurses, and not the nurses, scholarships for doctors and midwives. But when we had the approval of the Doktor para sa Bayan, nagtra-transition na po kami sa transfer of this scholarship program to CHED. So we're just completing the numbers that we have now, and then it's already CHED that will take on the scholarship program for the different cadres. So currently, we have about 2,539 scholars under the UH. We have started first year ngayon, nag-transfer na sila sa CHED in transition. And then, according to our meetings with CHED by 2024, yung pharmacy, medical technology, and midwifery will also be transferred already to CHED. But we'll just complete what we have already in the Department of Health. So as the last slide, for the production side, the direction is to utilize the concessions obtained from partner or receiving countries to enhance our HRH production. So part of this will be funding of scholarship grants. We are also contemplating of considering both local and global demand for HRH cadres for forecasting and projection. This is a study that we're doing now because we're also being questioned bakit daw magfo-forecast din tayo ng demand. But because this has been institutionalized in the country, so we're looking at ways by which we can look at manners that we maintain human resources in the
Definitely, I will defend
Opo.
you if people are criticizing because it is stupid and it would, let me change my choice of words. It would be ignorant of us to make plans without considering that.
Look.
Na the reality is X% and fill in the blanks later on are really leaving. So bakit hindi mo kakausapin? Para ka namang in denial, no? Na para ka nagpapatakbo ng public school, tapos lahat ng parents gusto pala mag-private school. Di, hindi mo kakausapin mo yung parents, tatanungin mo rin na, ba't kayo pumunta sa private school? O private school, anong meron sa inyo? So, by all means, you should continue having these studies and determining what's going on and what we can do about it.
So for workforce, we're also looking at return service agreements as a national policy, not just for government state universities, but also private institutions.
Well, for me, there must be some form of payback, no? Like, I am a graduate of UP. We were never asked for return service, but until today and until the day I die, I keep on doing what I can because there is no formal structure in place to pay back, to give back to the university that gave me my education. So, if we have to be the ones to put the structure, let's do that kasi marami namang willing. Pero medyo yung volunteerism sa Philippines, kailangan mong i-define ng konti to allow the people to feel more, for it to be more conducive. So I'm okay that you come up with more programs on that.
And another moving forward concerns that the updating of the Magna Carta for health workers. We've talked a lot about Magna Carta in the public sector, but not really in the private sector. And this has been a realization during yung surge natin sa COVID. So we'll work on that. For exit and migration, strengthening bilateral agreements to contain specific provisions on action both from the sending and the receiving countries to enforce the implementation and monitoring of agreements, both offers and requests from receiving countries. Examples of this will be scholarships, trainings, exchanges of expertise. So that ends the presentation, Sen.
Okay, so let me just post a few concerns based on that. But like I said, let's have this discussion later on kasi hindi na tayo makakarating sa ibang resource person if I keep asking questions. So I'm just gonna park these questions. What I need to hear, either both from DOH and from the other resource persons at some point, is what changes in the curriculum, and for lack of a better term, as I am not in the health profession, the scope of work. Ano ba tawag doon? Yung expertise ng mga health professions when they graduate. Because in other countries, yun nga, like yung sa nurses pa lang, they've empowered them in many ways. No? Merong yung nurse practitioner, doctor's assistant, I'm quite familiar because I've been studying it on my own, but again, it's not my profession. I want to know from the different, maybe in succeeding hearings, we can also invite the other professions to find out na, are you willing to take these steps? Are you willing to redefine? No? Because 17, 18 years ago, when I started these hearings, medyo very protective ang ang bawat profession sa kanilang profession. I don't know if that's changed. I hope it has changed because no matter how much I think a doctor or a nurse would like to tend to their patients, the numbers tell us that they are not capable, humanly incapable, which brings me to my next topic, yung hindi human, AI and digital healthcare. Who will talk about this? Who has the expertise to share this with us? If not, I will also get foreign experts to share this with us. Kasi during the pandemic, di ba, nakita naman natin na biglang natanggap yung online consultation. Kung hindi pa nga nagka-pandemic, very resistant ang both doctors and patients to that. But now it's a thing. And I think, I personally think that's great because it gives more access to everybody, kahit na yung may kayang mag-afford, saving on the time and everything. Pero ano ba yung downside? The downside is there's no, what do you call that, face-to-face contact and ano ba tawag doon? The examination. The examination won't happen, no? But I think over and above, it's a good thing because more people will have access, especially those who really don't have access. But have we put that in place? Is that in place? It's one thing like to say in Taguig City, it's in place. Pero kung talagang pupilitin, pwede naman mag-tricycle, pwede naman mag-kotse papunta doon kung kailangan. Eh yung far-flung areas nga na kahit gustuhin, wala namang kalye doon, hindi man makapunta doon yung doktor kahit gusto niyang pumunta doon. So, in place ba itong digital technology to make that happen? Okay? So, but for the next hearings na lang kasi I need to move on. Thank you very much, Yusek Ronquillo. So, let me now call on Ched, Executive Director Benitez Haro, and then please be ready, PRC, followed by TESDA, and then DMW.
Thank you very much, Senator Pia. So on the part of CHED, under the UHC, we have this several responsibilities. One is to reorient healthcare professional and healthcare worker curricula towards primary healthcare with emphasis on public health and primary care. Determine recommended areas of study in public health to be incorporated in the curriculum of all health sciences education and incorporate educational outcomes focusing on primary care in the education programs, the scope of licensure examinations, and continuing professional development. So far, Madam Chair, we have already integrated primary health care in our health professions education programs being regulated by PRC, including, of course, medicine, nursing, midwifery, dentistry, medical technology, pharmacy, physical therapy, occupational therapy, nutrition, dietetics, optometry, radiologic technology, respiratory therapy, and speech pathology. Since the supply of practitioners are coming from higher education institutions, Madam Chair, we take note that based on the records of DOH, there is enough supply for licensed nurses and midwives, but not enough supply for practicing nurses. We take note also that there is not enough supply for practicing doctors, nurses, and midwives. In order to address this
To be clear, you take note of, and I want to be sure kung tama yon, kung sa license lang na, ano yung inuna mo, nurse?
nurses po.
Kung sa license lang, there is enough, tama ba?
I think, ma'am, our good director here is referring to numbers of health workers in absolute numbers. So yung nakapasa sa license, ang sinasabi niya adequate naman, which is also
Is that accurate ba?
a part of the information that we have.
Okay, so let's dissect this later, no? Just because, again, in the interest of time. Kasi my understanding in a consultation I had with a group of health professionals, no, experts, was that kulang na kulang. So, kukuha tayo ngayon sa mga underboard, which of course is already a step down. Let's admit that because hindi pa nga sila pumasa ng board. So it's not because walang license. It's just that they're gainfully engaged in something else. And that includes not being in the country. Tama ba? So that's the big chunk, that they are not in the country. Okay, sige. So parang I think, again, you have to disaggregate that kasi wala ka na magagawa dun eh. Yun na yun eh. They're not even in our jurisdiction. Yung kaya mong i-manipulate pa ang figures, not manipulate figures, yung kaya mo pang, the reality that you can change are those who are in the country. 'Di ba? Na ba't hindi ng profession nila? Kasi they'd rather be a, what's the in job now? Call center. They'd rather do that. So let's face that reality, 'di ba? And kung ganun din lang, let's explore again, that's where I remember this hearing. The reason we're having this hearing in my committee is I'm balancing the various SDGs. They have the right to decent work. So if hindi nila kayang buhayin yung pamilya nila, practicing their profession, it's a no-brainer na maghahanap sila ng something na mabubuhay sila, di ba? That's why binabalance ko tong needs na to eh. I'm very mindful na this SDG 8 on decent work and economic growth goes hand in hand with SDG 3, which is health and well-being, di ba? So anyway, I interrupted you just because sabi ko, tama ba yun? Kasi nga, the bulk are not here. So parang wala rin.
Yes, Madam Chair, to continue. So in order to address these concerns, of course, for doctors, for the supply of doctors, Madam Chair, we recognize that there is not enough supply, both for the license and the practicing. Of course, through the help of the Senate, we have the Dr. Para sa Bayan. We have already implemented the Medical Scholarship Return Service law, the seed fund for state universities and colleges. For MSRS, as of 2021-2022, we have 400 scholars. For 2022-2023, we have more or less 900 applicants, Madam Chair. So these are already, of course, the goal here is to have doctors who will return to their provinces once they have graduated. First, the seed fund for...
Can I pause you there? And this is really more for my staff to take note of this concern that I have. When you said that ideally you want them to return to the provinces, no? I occasionally come across international reports or opinions, no, writings wherein cities in different countries will offer something that makes it very enticing for a certain profession to move to their city, whether it's teachers, kung ano man yung in demand na yun, whether it's teachers, nurses, or doctors. So I'd like to bring in the League of Cities here, and whoever else you think can assist us na dapat ganun eh, no? As we are empowering our LGUs, di ba? We have devolution, alam niyo naman yun, another thing that DOH has to deal with. I don't know if CHED has to deal with that, not really, kasi SUCs naman, no? Medyo hindi nyo problema yan. As we are empowering the LGUs, I'd love to see that, no, that the LGUs are now saying na come to my province, come home to my province kasi dito nag-aalaga kami ng doktor, dito nag-aalaga kami ng nurse, dito nag-aalaga kami ng teacher. Ito benefits para sa kanila. Papatayo kami ng condominium na may swimming pool. I mean, whatever it is that entices them, because that is the game. Like, why would they want to come back? Now, I know of so many, I have friends all over the country, and ang laki ng pwedeng i-offer ng probinsya eh. Ang ganda ng probinsya life, tapos you have all the amenities there. Ang ganda, pero hindi tayo ganun mag-isip eh. Pero in other countries, ganun sila mag-isip, no? The cities will compete for the best and offer them not always monetary, di ba? Pero like in the US, di ba, yung school districts nila, magandang paaral dito. So a family would like to move there because their children will get very good free public education. whatever, that's my point. So can somebody also be mindful of this? And that's where I'll tie it back to our first speaker, Dr. Suhail. If you notice in the beginning, he talked about walkable cities. From my discussions with a lot of migrant workers, especially those with degrees, with licensure professions, of course, the salary is attractive, no? But it's the idea of being able to live in a walkable city, in a city that has a park, in a city where they feel safe, in a country where hindi nababaril na governor, you know. So we can talk about anything, but those are pulls that take away our ano. So this hearing should not be limited to what DOH can do, what CHED can do to improve the quality of our health professionals and talk about the salaries and the distribution. It should be a whole of nation approach, which brings me to the other SDGs. It's 17 partnerships and strong institutions, di ba? Okay, so isipin nyo lahat yun kung sino yung resource persons natin dyan. Anyway, go back to you, Attorney Benitez.
Thank you, ma'am. So under sa MRS po, I would like to emphasize that they would have to return to work in public health office, government hospital in their hometown, or in the students' scholars' home province, or underserved municipality closest to the scholar's hometown. Since they are still students, we are yet to see, Madam Chair, kung talagang they will go back to their to the hometown. Pero may provision naman po sa law.
Correct. But this is what I want to ask you, and I'd love you to have a small group meeting with my staff, particularly DOH and CHED, but anyone who wants to participate is welcome. This is my question. I had a hearing, no, I had a consultation, not a hearing, with Ateneo de Zamboanga, you're sure? Not Davao, Ateneo de Zamboanga. Ateneo de Zamboanga Medical School. And it was explained to me how they take pride in the different approach to teaching the future doctors. They really ingrain in them the importance of primary health care in the community. So it's community health care. So you know what? They have the highest, and I'm happy to get other figures. They have the highest retention. They stay in, they really go back to their communities because their practice apparently from first year includes going to the community, serving the community. So, and again, this is not my profession. I don't mean to, to pretend that I'm an expert. I'm not. But even if I compare it to other SUCs that offer med school, parang dun ko lang nakita na ganun kalalim yung kanila, ganun kalalim. Kasi nga, from first year pa lang. So parang, for me, it's not enough that there's a provision in the law. It's not enough that you teach primary health care when you did not, for the 4 years that you had them, you did not, what's the word I'm looking for? Parang, hindi nyo talaga pinaramdam sa kanila yung importance ng community nila. 'Di ba? Yung parang, may 1 week lang sila immersion, that won't do it. It's part of their whole curriculum. Everything they do is with the community. So, that actually was a recommendation to me then, na ito yung dapat i-doktor para sa bayan mo, yung ganito magturo. Kasi kung hindi rin ganito ituturo, kahit ano pa yung, and lahat naman tayo naging freshman sa school, no? Lahat ng pangarap mo noon, pag-graduate mo, iba na eh. Kasi sasabihin ng pamilya mo, dapat ka kumita, yung obligation mo din sa family mo, nandun na yan, yung pride mo din na may specialization ka, when in fact, baka ang kailangan ng country mo is wag ka mag-specialize. Baka ang kailangan ng bansa mo is tutukan mo lang yung needs ng community. So, isipin na, ganun kalalim dapat tayo mag-isip. So, pag pinabasa mo sa akin yan, ganun kalalim ba yung primary healthcare na sinasabi mong nandyan naman sa curriculum? I will be proud. Hindi ka mapapahiya.
Lalaman po ang gumawa.
Yeah, but I'm saying you're reporting it to me. So bulungan mo man lang yung staff ko na, ma'am, may improve pa natin to. Be truthful and honest because I can only share what the experience I got. I'm sure there's so many other dimensions to this na hindi ko pa naririnig. Wala pang nagkwento sa akin, wala pang nag-share sa akin. So if we will not be honest with each other, ngayon pa lang mag-Holy Week break na tayo. 'Di ba? What's the point? What's the point? Pasusulatin ko yung staff ko ng committee report para sabihin what? CHED pala is doing their job, DOH is doing their job. Di, wala na lang tayong gagawin, di ba? So, I'm gonna bother with this in the hope and anticipation that we'll really come up with concrete solutions. Not one, not two, but 3, 5, 10. Okay? So all of you, look at your own sphere of influence na ano pang ma-improve nyo doon, di ba? Let's not be like, okay na, basta kami, sinabi na namin na mag-primary healthcare kayo, pero kung di nila didibdibin yon, there's nothing earth-shaking about what you're teaching them, aalis din lahat yon. Wala namang magbabago. Walang magbabago. So, ang tanong ko is, yung mga graduate nung Ateneo de Zamboanga, bakit sila ba? Wala din silang offer ba sa ibang bansa? Meron din naman, di ba? Meron din. Hindi ba sila nakakakita na mas maganda yung kinikita ng mga nag-specialize sa ganito, sa ganon? I'm sure nakikita din, but why? Why do they stay? So find out, and I hope na mas marami pang example na gano'n. It's just that yung naituro sa akin na mas alamin ko is yung Ateneo de Zamboanga na yon. Okay? So sa next hearing, be ready. Thank you.
Yes, ma'am.
O, wrap up na tayo.
Apo, actually, ma'am, yung what you're referring to is the Doctor of Medicine Public Health Program, Hybrid Program, Innovative Program of Ateneo de Zamboanga. We will take note of that, Madam Chair. For Seed Fund for State Universities and Colleges, so far, Madam Chair, under the Dr. Para sa Bayan law, we have 7 SUCs which have opened. Only 3 universities and only 4 regions now ang wala pong state universities and colleges po na offering Doctor of Medicine. These are Region 3, Caraga, Car, and Region 10. But so far po meron po.
Can I cut you there? Because that's data that's easy for me to get. More importantly is be prepared to tell me, ito bang mga graduate na to, magsistay nga ba sa country natin? Magsistay ba sila sa community nila? Okay, yun ang gusto ko malaman. And then my next level of question is, ano yung allied health professions na nandyan na makakatulong in the complete delivery of healthcare? Because alam naman natin na kahit mag-graduate pa sila, kahit na mag-stay pa sila, kulang pa rin ang doktor. Okay, I need to move on because talagang 3 o'clock yung deadline ko and it's on me. Okay, I'm not blaming anyone. Ako yung maraming tanong, ako yung madaming side comments. But okay lang? Okay. To be continued ka na? Okay, sige. Thank you so much. So, as I said, the next is PRC, Commissioner Erwin Enad. And then after, be ready, TESDA, and then DMW.
Committee Chair, members of the committee, stakeholders present today, good afternoon. This hearing is a welcome development on the part of PRC, in as much as knowing the status of the country's human resources for health is necessary for the harmonization of workforce planning, establishment of strategies in health sector covering several areas of concern. Now, as an agency mandated to administer, implement, and enforce the regulatory policies of the national government, with respect to the regulation and licensing of various professions, including the health-related professions, we will now provide you a big picture glimpse as to relevant data involving our highly skilled medical professionals, notably professionals belonging to the 10 professions, as mentioned in Senate Resolution number 396, series of 2023. So, next slide, please. As of March 24, 2023, we have 150 we have 951 105 nurses, registered nurses, with 509,297 in active status, Mr. Chair. So meaning to say, marami tayong doctors and marami tayong nurses, but only 53.55% of our registered nurses are with active status or with valid professional identification card. Next slide, please. As to registered midwives, we have 182,339 registered midwives with 69,475 with active status. In fine, we only have 38.1% of our registered midwives with active status or with valid professional identification card. Next. As regards to yes,
Ganito na lang, kung sa data lang, no, you can
Yeah.
consider that submitted.
yeah.
Maybe I'd really like to hear any other, observations, comments that you have. Otherwise, I'll deem this submitted in the interest lang of time.
Yeah, in the interest of time, Mr. Chair, Miss Chair, we have supply wise, we have these health professionals. Records would show that not all of them are practicing their profession.
So
So,
may-
in the context of that supply, registered, marami tayo. But for
Okay.
those professionals practicing
Okay.
their profession,
So maybe I can ask if you can all work together and determine, is this common in, is this the case? Because number one, we are a supply, what's the proper term? We are a country that supplies human health resource to
Yeah.
other countries. So common ba yan? If the bulk of this, as was established earlier, are migrant workers, edi in the immediate future, wala pa tayong agad magagawa. What we can do is what you mentioned, USEC, yung agreements, no, that we can figure out. And then as for the portion that are in the country and working elsewhere, then that's where we have more leeway kasi they're in the country. What can they do? Pwede ba sila mag-part-time kung ayaw nila na masyado? That's what we can explore. So maybe you can work out those figures clearly, and then even on your own for future hearings or technical working groups, medyo may idea tayo on what can we do. And when we start talking to the nurses associations, the doctors association, we can also find out. Okay?
Madam Chair, actually, our presentation reinforces the earlier observation of the CHED that we have the supply, but the practice of oppression on in that field, kulang tayo because konti lang yung nag-active.
O kaya nga. So I'm
Yeah.
taking it na nga
Yeah.
to the next level of discussion. So what do we do about it? Is there anything we can do about it? Okay?
Madam Chair, we're limited to our mandate, but we'll work with them on that area because we administer examinations. This is what our observations is the low passing rate with some professions with yung low passing rate is that may effect yung multifactorial kasi. Like example, Madam Chair, bakit in that profession sa health, mababa siya? What is quality of education, quality of graduation? On the part of the PRC, we have been giving feedback kasi who are those done performing to CHED. But of course, it's beyond us on that
Yes.
closure.
So perhaps on that note, no, I recognize naman na may specific kayong mandate. Maybe we can divide the technical working group discussions. Kayo yung magbibigay ng feedback nga dun sa passing and all kasi kung hanggang dun lang naman yung scope nyo. So can work na lang together to address these different, like who handles the issues with migrant workers. Of course, the MW should take the lead there, di ba? And then yung quality of education kayo, dun din kayo papasok si
Sa
PRC.
conduct kami,
Okay?
sa license.
Sige. So let's go to the next. Thank you very much, sir. Para lang I can call as many in the limited time I have. Next is TESDA, Ms. Rhea Dulampines.
Good afternoon, Madam Chair, and all the members of the committee. Maybe I'll just fast forward our presentation to the figures, ma'am. I would just like to highlight the accomplishment of TESDA relative to the provision of training and scholarship program. And right now po, we have 86 qualifications related to health, and we have a total of 21,073 scholarship slots. This was provided last year po, as of December 2022. And out of the 21,000 scholarship slots po, we have a total of 20,831 enrollees, and we have 17,710 graduates out of the 20,000 po. And we had a budget allocation of 446 million for that one. And relative naman po to the qualifications, I'm not sure if these are the qualifications that we need, but we have total of 2,102 caregiving with NC2 qualifications, 4,570 for contact tracing level 2, and wellness massage, 3,338. This is the top 3 po as of last year, 2022.
So if I can include you in that group on parang I go back again to the first speaker, si Dr. Sahil, on the overarching wellness, the wellness of a person, 'di ba? Kasi sobrang importante 'yan. And mas madaling mag-training ng ganyan, kahit na marami din maging demand sa kanila, which I'm sure marami din, yung mga caregivers, 'di ba? And then yung mga massage therapists, ang dami. Pero madali rin naman tayong mag-training kasi maiksi yung time to train them, 'di ba? So can I cut you off muna, and if you have just a short closing remark, because at least I know kung paano ko kayo i-group.
Okay,
Anything
ma'am.
else?
Thank you, ma'am. As you mentioned, the short courses, we also have the 3-year course, ma'am, the
Okay.
diploma courses, the health and social services and the nursing service management.
Perfect. Okay. Sige, aralin natin lahat yon, because I want to be sure that you're working very closely with them to make sure that the support staffing that is needed, kaya nila magbigay. Kasi just like teachers, ang daming reklamo na yung pinapagawa silang not related to teaching, di ba? Baka naman ganyan din sa mga nurses natin and other allied health professionals, di ba? Okay, thank you. Sige, so as I said, the next is DMW, Yusek Olalia.
Good afternoon, Madam Chairperson, and to my colleagues. The DMW is a fully constituted department, Madam Chair, manages the deployment of our workers, including our healthcare workers. And in order to manage the outflow of our healthcare workers because of the big demand from foreign destination countries, we adopt 4 initiatives or 4 approaches. The first initiative of the DMW is under the statutory framework. One of the provisions of Republic Act 122 is that no deployment will be allowed if after consultation with the DFA, there is a need to regulate or ban the deployment of any worker, including HCWs. So under this framework, Madam Chair, we experienced this during the COVID period, wherein the DMW, at that time POAA, imposed a total restriction of the deployment of HCWs, which restriction was lifted 8 months after, when we allowed a ceiling or a cap for deployment of 5,000 HCWs. The second framework that we adopt is the so-called interdepartment approach or framework. Under this framework, the Department of Labor and Employment issues a department order for the MCS or the Mission Critical Skills. It is an interdepartment framework wherein the Department of Labor, the CHED, DOLE, DMW, PRC are all on board. They meet regularly, take a look at the supply and demand of HCWs, and make a proposal on how to manage the deployment of workers overseas. The third framework is the so-called social dialogue and tripartism. We engage the stakeholders of the industry, especially the NGOs, the media, and everybody on board. Incidentally, one of the important projects now by our secretary is the so-called Nurse Scholarship para sa Bayan. We intend to engage the CHED on the grant of scholarship involving the Canadian government. We asked the Canadian government to put up a fund in order to provide scholarship to deserving students on, for example, on the 3rd and 4th year, and then after a while, they will serve community service for 2 years before we allow them for deployment. The last but not the least, Madam Chair, this is the so-called bilateral cooperation.
Na yon, what is the status of that recommendation? Is it a recommendation? Is it a policy?
It's an ongoing project with CHED, ma'am.
Yung itong requirement na
yes,
community service.
Yes.
Okay.
Okay.
Kasi that's what I'm hoping, that you can all work
It's a
together para it
proposal,
can
yeah.
be an official recommendation na rin of the committee kung paano natin gagawin yon, ha? Okay, thank you. Sige, go ahead.
And the last but not the least is the bilateral cooperation framework, wherein we engage with destination countries and forge an agreement that is beneficial not only for the supply, but also for the demand of the.
Now, that's also a new thing, that because obviously the department is new, so it's new. Wala pa tayong movement dyan.
We have a lot of BLAs,
Okay.
but we regularly assess and review the BLAs prior to any renewal
Okay.
or the.
Can I just have a separate discussion with you on that? Because I'd really like to get more details on
Yes,
each.
Madam Chair.
Thank you so much.
Thank you.
Okay, thank you. And the last person who is physically present here is PNA, Mr. Melvin Domingo Miranda, the National President. Sir, you have the floor.
Good afternoon, Senator. On the perspective of the Philippine Nurses Association as the accredited professional organization, it's on meeting the targets of the Sustainable Development Goals perspectives from the Filipino nurses as healthcare workers. The Philippines remains to be the choice of the world when it comes to the healthcare services. Nurses, to be more specific, according to NARE and Cleland Silva in 2021, Smith and Gill in 2021, as if they are made for export, as according to Medallia 2023. In ELMACO 2022, roughly 70,000 Filipino nurses work overseas in 2008 to 2012. We have supplied 240,000 nurses of the countries under the Organization of Economic Cooperation or OECD, such as Austria, Belgium, Canada, Denmark, France, Germany, Iceland, with an estimated outflow of 15,000 to 20,000 per year, according to Alibudbud 2022. In 2017, an estimate of 145,800 Filipino nurses are deployed in the United States, according to Badaloba, as cited in ELMACO 2022. The annual immigration rate of Filipino nurse is at 71%, as derived from the estimate between 2012 to 2016, where a total of 26,000 licensed nurses were trained, with an estimate of 18,500 that moved overseas annually, as according to the POEA and Commission on Higher Education, as cited in ELMACO 2022. Various nurse reports denotes the recruitment already begins in the Philippine schools and colleges of nursing by providing nursing students competitive educational scholarships in exchange for immigration post-graduation. This is according to Jamalin 2023 and Requejo 2023. With all this, the Philippine Nurses Association highlights that we are far from reaching the human resource requirements as aspired by the tenets of the universal health care because of the eminent phenomenon of Filipino nursing diaspora, because of the various pull factors found outside of the Philippines. It is but time to provide Filipino nurses what is due for them, specifically benefits they were deprived since time immemorial. In order to establish a strong human resource for health, HRH, as a response to dictum of SDGs 3, 8, 10, and 17. PND Strong upholds its 10+1 welfare and professional development agenda. Number 1, inclusive implementation of nursing salary, leveling of nurses' salary for both government and private sector. That is, SG15 for nurses in the private sector and standardized nurse 3 or higher salary scheme in government institution. Because nowadays we have a concern pertaining to the salary grade 15 implementation and 16 because it is not covered by the Department of Budget and Management. They don't have a legal basis for the nurse 3 to adjust their salary up to the nurse 7 because there are no legal basis as according to the DBM. Nurses compensation, that was on December 2022. Nurses compensation be the primary focus of legislation. Implementation of salary grade both in government and private hospitals for all nurses, regardless of nature of employment in private or public sectors, must be the ultimate consideration so that nurses will remain in the country. Number 2, government should open new plantilla, regular positions for nurses in both nursing education and
So,
health sector.
sandali parang hanggang number 12 yan, nasa number 2 ka pa lang. So, as I said,
Summarize.
kung nandyan naman lahat yan, I promise you, babasahin ko yan ngayong araw na to. I-highlight mo lang yung importante, and then we need to wrap this up.
Yes, ma'am. So probably one of the important here is the number 2 because even the Department of Budget Management mentioned last 2022 of December, they still have the vacant position of 4,752
Yes.
for regular positions. But indeed, why it's still vacant? And we don't hire them. And for the entry level, it's still it's 1,100 supposedly of the hiring of 1,100 regular positions. So that is still hanging on us because we
Okay.
don't have reports of DBM.
Okay, sige. We will, I will look at that. And the nurses obviously being such an integral part of our delivery of the healthcare service, rest assured na lahat ng points mo, aralin natin, and we'll see what we can do. Okay?
Yes, ma'am. And
Thank
I
you.
think one of the highlights din po is gearing towards on the expanded role of nurses with
Of
the
course.
advanced practice
Well,
nursing.
which I am
Yes,
a
ma'am.
proponent of. In the bill that I worked on and I filed, right?
Yes, ma'am.
Nandun lahat yon, yung iba-ibang specialization ng nurses, and I hope umpisahan na yung hearing na yan.
Yes, ma'am. Because it is in
Okay.
our response to the implementation of
Yes.
universal healthcare.
Exactly. Yes. Okay, thank you so much. Okay, that's it for all the persons who are here today. I'd like to acknowledge the presence of those who are online. Dr. Tony Dance of the UP College of Medicine, Dr. Marilyn Lorenzo of UP Manila, Jocelyn Andamo of Philippine Nurses United, and Dr. Edmond Lopez of Philippine Hospitals Association. As I said, I apologized ahead of time because I can only stay till 3 o'clock. I will ask those who have not spoken, particularly those online, in the next hearing, you will be first. But everyone who's present today and everybody, whether online or physically, the door is open. This topic has been started. My staff is ready to be overwhelmed with your comments, observations, and suggestions. And the Senate is on break, so we do have the time to attend to this. Thank you for the heart, Tony. But we will really make this a priority. So mag-Holy Week lang kayo, but this week working kami, so reach out to us. It's just that I do have this time constraint for the 3 o'clock. So I will not have a technical working group yet kasi part 2 ng hearing to hear all of you. But those of you who want to work among yourselves and with the assistance of my team anytime, to already come up with some answers to the questions I raised, it would be very much welcome para for the month of April, we can be very productive. So again, my apologies for not being able to accommodate those online, but rest assured you'll have your time in the next hearing. Maraming salamat, and this hearing is suspended until the next.